All right, everybody, how are you today? This is Steve Berlack, the Inner Vision Navigator, and we have a new episode of Your Inner Champion. I'm really grateful to have you all here, and I have a very special guest. Before I get to him, I just wanted to say two things to you. Please make sure, if you haven't done so already, hit that subscribe button. It is free. It costs you absolutely nothing, but it helps the channel a lot more than you may know. And if you haven't done so already, please hit that bell so that you can get notifications whenever we have new episodes of Your Inner Champion coming. So having done all that, let's jump right to it. Again, I have a very special guest, Dr. Kavan Clifford, and I would like you, Dr. Clifford, if you would please just talk to the folks. Who are you? They'd like to get a sense of who you are, and then we're going to jump into some questions to vaccinate or not to vaccinate. And that's going to be a real issue because it's really affecting us. So who are you, Dr. Clifford? Thank you for joining us, first of all.
Well, absolutely. It's a pleasure to be here. It's a pleasure to get this opportunity to interact with you and to share with all of your followers just information. That's all I'm here for, just to provide information. I'm not here to judge, to bully, to point fingers or otherwise. That doesn't impact and make any definitive change. So who I am, my name is Dr. Kavan Clifford. I was born and raised in Trinidad and Tobago in the Caribbean. I left Trinidad to go to college at Morehouse College in Atlanta. After Morehouse, I was lucky and fortunate enough to enroll at the Johns Hopkins University School of Medicine, where I pursued both a medical degree and a PhD. So I'm an MD, PhD, a medical scientist. And that's where I met Steve when I joined the one and only fraternity, Kappa Alpha Psi Fraternity Incorporated. And Steve is my lion brother. While I was at Hopkins, I did my PhD in neuroscience, looking at chemotherapy-induced peripheral neuropathy. And at the end of my graduate school training, I then went back to medical school and eventually applied and pursued residency in anesthesiology and critical care medicine. After those 4 years, I did 2 fellowships in advanced anesthesia training, one of which was in regional anesthesia, which involves using local anesthetic to mitigate pain, numb different parts of the body that is going to undergo surgery. And also another fellowship in neuroanesthesia, where I do anesthesia specifically for neurosurgical cases. At the end of my training and fellowships in 2017, my family and I moved to Florida. So I now live in the Fort Lauderdale area, and I work at a level 1 trauma center, doing both neuroanesthesia, of course, where I serve as the chief of neuroanesthesia, as well as regional anesthesia, and the other thing that I was fellowship trained in. And most recently, I've also been appointed as our assistant program director for our anesthesia residency program, where we're training future anesthesiologists. So that's kind of how I got to here and how I got to who I am, and why Steve and I have been talking about this particular, I didn't want to really say hot button issue, but an issue that is important to not only each individual, but to us as a community. So I'm happy to be here and happy to get these questions going and get these thoughts out there and discussion open.
Yes, sir. Thank you, Dr. Clifford. It really is a pleasure having you here. Certainly, you have the expertise to provide the opinion, an informed opinion that a lot of people may not have access to. So I'm very grateful to you being here. So
and I of course am speaking for myself. I know we have all these things that we have to go through where I'm not speaking for Hopkins, I'm not speaking for my hospital system. I'm speaking based on my personal experience, my personal knowledge, information that I've sought out, and the people that I care about. That's what I.
Awesome. No, that's a good point to make. Yeah, thank you so much for that. All right, so let's jump right to it then. So the topic at hand, right, to vaccinate or not to vaccinate, right? And what brought this about was a conversation you and I had, and those of you that follow me know I just had contracted COVID-19, and I was in the hospital when you and I had this conversation about whether or not I should speak to the audience about being vaccinated. So as a doctor, what's your stance on vaccination, the vaccination issue, whether or not people should get vaccinated or not, and why do you have the stance that you do?
All right. So the simple end of it is that we all want COVID to go away, right? We're all, this virus kind of quote unquote came out of nowhere. I think it shook the foundation of our whole society and the world in late 2019, definitely for the world 2020. I think everybody remembers March 2020, when everything just was different, right? And as soon as, and then of course for us in the hospital, like we got to the point where cases were getting big, the hospitals being filled, we're trying to take care of patients. And we got to the point where we had to shut down our elective surgery. So basically, if you wanted to have your ankle surgery done because you twisted your ankle playing soccer or football 15 years ago, and now you have arthritis in your ankle, you couldn't come to the hospital to get surgery because we had nowhere to put you, right? As a result of that, on 2 occasions last year, I volunteered my skill set to work on my hospital system had a COVID line and intubation team. So what that means is that we go around and we take care of the COVID patients when they need to get big invasive IVs in their necks to give their medication, fluid, blood, keep their body going, as well as placing a breathing tube when you're gasping for air and you're not getting enough in and you're tired and your lungs aren't working the way they're supposed to. And we had to do that. So we had our hospital system supplied great PPE. We were always protected. I said I would not endanger myself or my family without doing it the right way. And I realized after about 2 or 3 weeks when doing that particular change of my responsibilities, that for many people, I was the last person they spoke to, right? Where even if they're gasping for air, the mask on, I was still going to say, just using you, for example, Mr. Steve, Mr. Berlack, I'm Dr. Clifford. We're going to take good care of you. I'm going to place the breathing tube to help you get some rest and to help you breathe better. And for so many of those people that I placed the breathing tube in, they never took it out until they went to the morgue. And that hit me. That struck me. And, one afternoon, it's just like, I can't believe that I'm the last human voice that they would hear, because once you put the breathing tube in, we keep you sedated. So you're not there with a piece of plastic in your throat because no one can tolerate that. So the realness of COVID always hit me. It was always this thing that impacted the lives of not only my patients, but the people around them. I remember, taking my phone out to FaceTime somebody's family member before I placed a breathing tube in. And that was probably the last time they saw their own family member with their eyes open. So COVID for me has always been very real. I wanted to say very dangerous to the people who it affects that way. And for that reason, I was always very secure about, I wanted to protect myself because I was at that point, we all shut it down. I was the only one leaving my house.
Yeah. Okay.
My kids, my wife, they were at home. So anybody bringing it home was me. And I took great responsibility for that. And I did everything that I could to minimize the risk of bringing it home. But early on, I always said I wanted for 3 things, one of 3 things, or all of 3 of them. I want either cure, treatment, or vaccine. Whichever comes first, I'm taking it, right? Because I had to make sure I had the protection I needed to keep doing what I did and keep taking care of patients, but keep protecting my home space. And so the vaccine was the first thing we got. Now we have some treatment. We don't have a cure, right? So we now have 2 out of 3 available, and that's a good thing. No one could say it's not. So for me, the idea, once the vaccine became available, I think my hospital system in Florida was one of the first 3 in the state to get an allotment of vaccines. I was there on day 2, right? And I got my first dose December 16th last year, my second dose on January 5th, our fraternity's anniversary of this year. And I got my booster dose 2 Mondays ago, yep. Right? So for me, vaccination was a tool of protection that I won't leave on the table, because I promised my kids and my wife that I would do everything to be there for them and to protect them. And we can take a pause, we can go more into it, but the vaccine's goal is to keep me out of the hospital and dead. Everything else is cherry on the pie. The vaccine's goal is to keep me out of the hospital and being dead.
I'd like to address that. And you made some excellent points, obviously, a lot of which I agree with. But I have had some conversations with people who are close to me. As a matter of fact, I'd like to get your thoughts on this. My very first night in the hospital, in the emergency room, as I'm starting to get treatment, one of the first nurses I came across, and now you should know I'm here in Georgia, right? So one of the first nurses that I spoke with, of course, the first questions they asked me, were you vaccinated? That was like one of the first things they wanted to know.
Yeah.
I told them that I was not. Now, there's a very specific reasons why I had not been vaccinated, right? Mm-hmm. So for me, I have asthma and I have allergies, and particularly here in Georgia, if anybody's lived in this area, if
Yeah.
you have allergies, the pollen here,
Pollen is no joke.
allergies, yeah. So I was having trouble breathing for years before I even contracted COVID.
Right.
And I had actually taken a flu shot years ago,
Yeah.
and I had a very severe reaction to it. And so
Understood.
I was very concerned with getting the vaccine and having this severe reaction on top of my allergies and already being unable to breathe. And so that's one thing. When I talked to this nurse, I mean, she asked me, had I been vaccinated? She then says, well, I'm not going to do it. This was her. This is a nurse, right? And she's like, I'm not going to do it. And she said to me, she literally showed me on her phone all these different websites that she had researched. And they were talking about how the vaccine was not, because you made a key statement. You said, no one can really argue, that this is a good thing. We have 2 of the 3 things that, that we need. Yeah. And yet here she was arguing that it's not a good thing that we have these vaccines, that it's not something to be trusted. And she's just showing me on her phone all the reasons why. What do you say to people, both inside the medical profession who have access to medical knowledge and what's coming, and then even on the other flip side of that, people who don't even have medical knowledge, they really don't know what's going on, and they're afraid. What do you say to them?
No, and that's the biggest challenge, right? I said, I tell people all the time, science is hard, science is detailed. And the attention span that you get when you have an opportunity to engage with someone is often very short, right? So basically what ended up happening is that you have government, scientists, doctors, whatever it is, shouting, get the vaccine. Anybody's like, okay, that's all the information and engagement that you're provided just as a public general layperson. And that's not enough, right? So
can I push that? Why isn't that enough? Why isn't it enough for somebody who has the knowledge to say, get the vaccination? Why isn't that helping?
So I have had discussions with folks talking about, people who don't get vaccinated, they're so easily influenced and da-da-da-da. And I said, no, they're not easily influenced at all. Because if you're easily influenced, me just telling you, hey, get the vaccine, I'm a Hopkins trained MD, PhD, anesthesiologist, critical care doctor, just listen to me. That's not enough because people have their reasons for not wanting to. For example, you just admit, you said for yourself, you had a bad experience with the flu vaccine, you have bad asthma and you have allergies down there that affected your breathing, and you have concern. That is a genuine concern. So if I just tell you, hey, Steve, get the vaccine, you're going to say, well, you don't know who the hell I am. Right. You don't know what I care about and what's important to me. Right. So that's why it takes longer than that. Right. Especially when you have swirling information going around saying one thing or the other, people who are scared, people who don't know, and then people who have distrust. All of those things are valid. Right. So regarding your nurse finding articles that supported or suggest that the vaccine is, what she said, not safe, or she won't take it. Yeah. That's fine. I always tell people when 2 things happen together or around the same time, the 3 C's come into play. And the 3 C's are coincidence, correlation, and causation, right? So you can find an article talking about somebody got the vaccine and they had a clot in something, or somebody got the vaccine and they had Guillain-Barré, or somebody got the vaccine and they lost a baby, or you have somebody had a vaccine and they came out his cousin's testicles swell up, whatever it may be. When the way to start interpreting that information is what is the denominator, right? So if you have, so basically if I see a bird on a beam of metal and the metal is bent, I could say, well, look, the bird just landed on that beam and bent it, right? But how do I know that's not true? Because if I take 1,000 birds and put them on the beam, nothing's going to happen to the beam, right? So that's between coincidence, correlation, and causation. So really it depends on what the denominator is. So what is the big number? So this is a case of blank out of what? And causation, you're going to see the numerator, the number on top. I have 1,000 cases of bad asthma after the vaccine when I gave it to 1,200 people. Then you could say, that's concerning. But if I have 1,000 cases of asthma reactions when I get the vaccine, but I gave 7 billion people, that's probably just a coincidence, right? The random acts of 2 things happening at the same time, right? The best analogy I give for people who argue with the vaccine and the thing about that, I always say the vaccine was made because COVID was bad, right? We've had all different types of coronaviruses, all different types of communicable diseases that we don't have a vaccine, don't shut the world down for. People were dying faster than we ever thought it would happen, right? So science has to do something, right? The best analogy I have for that is seatbelts. Okay, I work in a level 1 trauma center.
Yep.
So I live in Florida, where people drive crazy at times.
Yep.
So I see people coming into the trauma bay, level 1 trauma center, MVC, GCS, blah, 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 blah. And I come in, the patient might be bleeding in their stomach. They might be unconscious. We place the breathing tube, we get them fluids, that kind of stuff. They have a big, huge bruise across their chest, right? I can see 10 of those in a month. Am I going to suggest to you that, hey, we shouldn't wear seatbelts anymore? Because I saw 10 guys come with a bruised rib and a bruise in their lung in a head-on collision, but you're not dead though. Right? Whereas, so that's the thing, is like, yes, the vaccine isn't perfect. Everything has side effects. Everything has an impact because we're stimulating your immune system. But when you look at it over the denominator, is the same argument as seatbelts as opposed to car crashes, right?
Exactly.
So it's like, yes, you may have somebody who came in like, dude, my collarbone is still messed up because I crashed this car and that seatbelt shattered my whole bone and it punctured my lung and I was in the ICU for 2 weeks. Your story is awful, not denying that, but it's by no means the way to say seatbelts are the enemy in this story. You see what I'm saying?
Right. Absolutely.
Okay.
And that's a great story because I've actually heard that analogy made before. And part of the backdrop of that is that people were not wearing seatbelts and were dying. Until the government stepped in and said, listen, this is the information we have. This is the study we've done. And so we're actually going to pass laws that regulate what happens when you get in that car for the safety, not just of yourself, but of everybody else.
But the funny thing about the seatbelt analogy is that it really only individually protects you. Whereas a vaccine, promotion of vaccination gives you a personal benefit, like I said, to go to the vaccine to keep you out of the hospital and dead. Right. But you also have the global and the community impact of immunity that's impacted by that. So it's as if you had seatbelts, but you also had cars that have sensors that don't hit each other.
Yes.
Right.
Yeah.
So it's a combination of things. And that's why it was so important. And that's why you found that there were people who were so impassioned about just get vaccinated. And I'm like, I just want to give you the opportunity to get their questions answered. And you have it based on information where you don't feel like you're crazy. You don't feel like you're a selfish. You're not a jackass. None of that stuff that we keep shouting at each other. It doesn't help you make a decision or change what you're going to do. But we can talk to each other and at least I can understand where you're coming from. Like, I didn't even know that you had the history with the flu vaccine, you know, and how bad your asthma and your allergies were. So now that we're talking, I can help engage you and help to show you, you know, what the benefits and the risks in there are.
Now, I have to ask you this, and I almost hate to go here, but this is real. I mean, this is what we're facing.
Absolutely.
As a doctor, what do you say to the folks out there who, and I don't know that there's an answer, but what do you say to the folks out there?
I probably have one.
Okay, that's all right. I bet you do. I know you, sir. I bet you do, brother. So what do you say to the folks out there who say, I don't believe it? You can give me all these stats, you can give me all this research. I don't believe it. I don't believe COVID's real. I've actually seen somebody say, I went to the hospital and I didn't see any COVID there. And I don't believe it. And I believe in, you know, my family's always been healthy. I'm healthy. And this is one thing I've always heard in their arguments, the word I'm healthy. I'm fine. My family is fine. We've always been healthy. And I figured we're just going to let life go the way it always has, and we're going to be fine. I don't trust anything you have to say. What do you say as a doctor to folks like that?
So that is a phenomenal question, and you touched on many parts of it. The I thing, right? The I, and I think we've all heard people say, "Oh, the anti-vax people are selfish," right? People who get vaccinated are partly selfish too, because, like I said, a major component of it is a personal protection. Right? Currently, the booster situation in the States is generally a personal protection mechanism. We're not gravely assisting the global approach to herd immunity by giving boosters right now. I'm going to say that out loud. It's just a factual thing. So the personal protective mechanisms, personal concerns is normal. We're all human, right? That's called self-preservation. So focusing on self is not the problem. The problem comes in when you deny the impact of your decisions on others, right? And that is where you can say, like, I haven't seen COVID. I'm happy you haven't. But if COVID continues to function the way that we expect it to and the way it has, you are going to, right? And I think for a lot of folks who chose not to get vaccinated, especially early on when vaccines were available, you know, vaccines came out in December of last year. We had been in COVID, like deep in COVID for about 6-7 months at the time. And people, you know, we had shutdowns, you had masks, you know, all the different mandates and all that kind of stuff, social distancing, all that kind of good stuff. And people found a way to keep going. Testing was up and down. Some people may have had COVID, never got tested positive. Some people might have had it, might have had a false negative. Some people knew they had it. And I think a lot of folks who chose not to be vaccinated were continuing to approach it as they're planning not to get COVID. See what I'm saying?
Yeah.
So the real options are, you have 3 options moving forward. Are to stay home and see no one, which for some people is possible. Like there's some people who are wealthy enough, they can get everything delivered. You can leave it in a box outside. I'll pick it up in half an hour, spray it down with a UV light if I want to, whatever it is. And you can work from home and you literally interact with no one and you will be perfectly safe. The second one is to get vaccinated and protect yourself that way. And the third option is you're going to get COVID, right? And over time, if you're going out in and out of public, you're going to get COVID or you're going to encounter SARS-CoV-2, okay? So with that in mind, then my thing for my rationalization or way I understood it for myself was I want to be as protected as I can be when I encounter COVID, not if.
Not if.
Right? And that's the difference. So I know many people, like I have family members who are not vaccinated and they're like, I'm good, I've been doing this. I'm like, I get it. But if you keep going in and out of your house, one day with all the variants and stuff you're going to have, you're going to get COVID. And it's just a matter. Yeah.
That brings me to some other objections that I've heard to the vaccination based on that. And you know, we could argue the point because I know that, you know, the odd thing for me is that there are people who just don't believe that, right? And that's it is what it is, right? They literally just don't believe it. Like I'm just not going to get it. In fact, I actually saw an interview with a woman whose son, 8 years old, got COVID and continues to be sick. And at the time she was interviewed, they asked her, are you going to get the vaccination? And she said, no, I'm not going to do it. And she said, why? And she just said, I don't trust the government, right? And we're right back to, you know, I just don't trust them. Right. But so to get to that issue of trust, let's get some information out there. My understanding, there's 3 vaccinations for COVID now, right? You have Pfizer, Johnson & Johnson in the US, and you have Moderna, right? Yeah. And so which of them are actually approved by the FDA and or the World Health Organization?
Right. So they're all 3 of them are approved by the FDA. Okay. And our CDC and our leaders in that regard for vaccination. So far, Pfizer is the only one FDA approved and cleared for booster or 3rd dose. Okay. This week, Moderna and Johnson & Johnson submitted their request to get approval for booster implementation for the same vaccine. There are other vaccines in the world, Sinopharm and all kinds of stuff all over the world, and other types of vaccines as well. But in the US, we have 3 options. Yeah.
So all 3 are fully approved by the FDA, not just for emergency purposes. They've gone through the whole process, or are they only approved for emergency purposes?
Pfizer, they're gone through the whole process.
Okay, perfect. And that's information, right? Because there's a lot of folks out there that don't know this, right? And I think this is good to get that out. So here's another question for you that I think strikes at people's fears about this. Yeah. Why is it that people who have gotten vaccinated can still get COVID? Right? Like what's happening there, and like what's the mechanisms there?
Yeah. And so let's I'm going to make a quick distinction. Sure. Okay. And the analogy I use for this is HIV and AIDS, right? So technically, in our conversations, we say you got COVID, right? You had COVID, right? The illness that you had requiring you to be hospitalized, that's COVID. Yes. You can test positive for SARS-CoV-2, right? What's the okay. Right. So what's the difference? Magic Johnson is HIV positive. Yeah. Does Magic Johnson have AIDS?
No, he does not.
Right, and you understand in your own mind that difference, right? Yeah. So basically the vaccine prevents AIDS. The vaccine prevents severe COVID infection leading to comorbidities and illness where you require hospitalization, extra oxygen, and eventually death, right? The testing positive for SARS-CoV-2, which we semantically say, I tested positive for COVID, that's actually a misspeak, but I'm not going to beat anybody up over the head of that because we all do it. But just to elucidate what I'm going to talk about now, you're testing positive for the presence of SARS-CoV-2, okay? So this is how it is. SARS is a virus that you were tested by swabbing your nose. So let's say we have person A, we're going to call Mike, and person B, who we're going to call Steve. I'm going to call your name, right? Mike is unvaccinated. Steve, you're not vaccinated. Mike and Steve go to a festival, go to a restaurant. Let's say go to a restaurant. And John on the table next door doesn't know he's positive, but he knows about it, doesn't care, and he's outside, and he's not breathing out. So let's say Mike and Steve are on two tables, and John is in the middle. Both Mike and Steve get 1,000 droplets of SARS-CoV-2 viral particles, right? Comes towards the table, they take a breath in, it's now sitting on their ears, and the virus is like, okay, let's put my steak here, I'm about to start trudging and going in, right? Mike is unvaccinated. Steve you're vaccinated. As those 1,000 droplets get to Mike, 300 of them kind of die off because they're weak or they're tired from the flight or whatever it is. 700 of them are not going to work. They're starting to invade the cell, starting to multiply, make these little large cells together, coalition, get into your lungs, start causing extreme inflammation, getting sick. So that takes about 4 or 5 days. He starts feeling a little bit sick, a little bit febrile, a little stuffy, whatever it is. You get a dry cough. Next thing you get tested on day 6. Oh, it turns out positive. Like, okay, by day 10, breathing is really tough because these viral cells are all over the place doing their thing. Goes to the hospital day 11, spends 2 weeks there. I meet him on the line in the intubation team, say, Mr. Mike, sorry you have to meet like this. I'm going to take good care of you, replace the breathing tube. We put you on pressors, your kidneys fail, your livers fail, your heart's not working well. We put you on ECMO, eventually a week and a half later you die. So y'all both had lunch at this restaurant 6 weeks ago. Mike is now dead, right? Steve is the other side. Same 1,000 droplets get to his nose, 300 get tired, they don't really do anything. The first 700 start to fight, but he's vaccinated. So his body's like, hey, that's them SARS-CoV fellas. Hold up, right?
Yeah.
So they start fighting. So now their 700 gets break down to 500, gets break down to 300, 200, 100, bam. So by day 2, you're like, I feel the thing, all right? Feel a little weird. This just feel like a cold, I have a little muscle ache or whatever. And then by day 5, you might say, let me get tested. Boom, I'm positive for COVID. Right? By day 7, their soldiers are down limping off the field, they're hurt, and you're done. You're like, I feel better. That was kind of rough though, but I'm all right. See the difference?
Okay, yes, I do.
So you're both tested positive for SARS-CoV-2. The vaccine, because you have soldiers ready to fight, are there to prevent you from going to COVID.
Yeah. So,
right?
So if I can just put it in layman's terms, I just want to make sure everybody hears this right. So getting vaccinated does not mean you will not test positive for COVID. But what it does mean is that if you do get tested positive for COVID, you now your body is more equipped to fight it, and you're less apt to get really sick like someone who's not vaccinated.
When I started off, the vaccine's job is to keep you from being in the hospital and dead. Right? And so what changed with Delta was just how fast these soldiers were moving.
Yes.
Even us in the hospital, we got caught like, whoa. Yeah. Like our cases went from 30, 40, 62, 97, 130 in like 5 days. It was just, right? So basically like that 1,000 soldiers, like the 300 that died off with the old variant, they were still there. So you had a full 1,000 coming in, and they were just like attacking and just going to town. And Delta really pushed the boundary of how much protection you got from vaccination. And it still showed 90 to 95% of the patients in the hospital were unvaccinated. Yeah. Whereas their body, they saw these guys and they were running hip, right? And that's what happened to you. They were running hip, right? That's the time how it works. The funny thing is, I live in Florida, our government, we're big on Regeneron, right? Regeneron happens, okay, you test positive, you feel sick, you test positive for COVID or SARS-CoV-2 technically, and you go to an infusion center outside the ER and they put an IV and they give you this infusion over an hour, they watch you for 2, and you weren't even eligible for it. Why was that? Because it was too late, right? Regeneron is basically what the vaccine did with your own body. but you're taking it from somebody else.
Yep.
Right? You're
Own
taking
antibodies, yeah.
it's like
Somebody else's antibodies.
It's literally just, you just, instead of you having your soldiers on base, Regeneron is bringing in a fleet from the ocean.
Right.
And they're coming to fight with you of allies.
Right. Thank you, as always, for watching Your Inner Champion. Coming up next week on part 2 of To Vaccinate or Not to Vaccinate, Dr. Clifford and I discuss what drives the division between those who want to get vaccinated and those who refuse to get the shot, no matter what. Don't miss this important and timely conversation on Your Inner Champion. See you then.
A lot of followers are like, oh man, brother Steve got it, but he's been trying to do his thing, but he still got it. See, nothing can be done, not knowing why he didn't get vaccinated. Right. Now they get a grasp of, okay, so he had a core reason for him personally why he didn't want to do it. He's not an idiot. He's not stupid or selfish.